small genetic component too. A lot of people say, well, my father has Parkinson's, am I going to get Parkinson's? Probably not. So the genetic predisposition is only about 10% at the most of people who have a gene that predisposes them to Parkinson's. It's really more the environment.
Can you characterize the difference between Parkinson's and Alzheimer's?
Parkinson's and Alzheimer's. Yeah, so Parkinson's predominantly affects movement. So it's similar in that it attacks various parts of the brain. And for Parkinson's, the deep nuclei in the brain that control movement are affected first. Although Parkinson's does eventually spread to other parts of the brain, like the cortex, and people do get memory issues. With people with Alzheimer's, the plaques that are deposited are located more in like thinking and memory centers of the brain. So it is a different like pathology, like when they look at it. So plaques and tangles are what they see when they look at a brain that's affected by Alzheimer's. And I'll talk about in a minute, with Parkinson's, the hallmark are called Lewy bodies, and we see these Lewy body deposits in cells. So it's kind of a different underlying pathology and where in the brain it's affected the most. All right. So we unfortunately live in the Parkinson's disease belt. There was an epidemiologic study done in 2010 by this group, Willis et al., and they kind of mapped out the United States and determined where the highest concentrations of people with Parkinson's were. And it was found that people in the Midwest and in the Northeast, where we live, have more people with Parkinson's. And again, more pesticide use, manufacturing, denser populations, and more people who have been exposed to military chemicals and warfare. Any questions about that? So we now know there's tons of people being diagnosed with Parkinson's. What are we going to do about it? So by 2030, we're estimated to have approximately 1.2 million people with Parkinson's in the United States. And that's a really conservative number of people. It's probably actually higher than that. And approximately 40% of people in the United States and Europe still do not see a neurologist. So, as I mentioned before, Parkinson's is extremely complex, and it really should not be managed by a generalist physician alone. The medications that people take need to be very fine-tuned. There's tons of crazy side effects that can occur, and the disease can really be mismanaged if people are not seen by a neurologist. And specifically, if you guys ever have clients who are in your class and they mention that they don't have a neurologist, please encourage them to get one. And even better, encourage them to get a doctor who specializes in Parkinson's, and these doctors are called movement disorder specialists. And we have a great group here at Strong called the Movement Disorder Center, where they have a bunch of doctors who really specialize in Parkinson's.
What are some of the symptoms, and how would you know to see a neurologist if you have not even been to your doctor to say that this is Parkinson's?
Yeah, so what are some of the symptoms? I'm going to get into them. There's a ton, but I will tell you some people, actually the very first symptom that most people experience is one that could be a million other diseases, which is constipation, believe it or not. So tons of people have constipation for many other reasons besides Parkinson's, but very vast majority of people, the first symptom is actually constipation. Decreased sense of smell. So if someone can't smell things anymore, that's a significant sign for Parkinson's disease. People acting out their dreams. So if your care partner is sleeping in the middle of the night and has a tendency of like thrashing around and even vocalizing in their sleep, that's another sign. So that's REM sleep disorder behavior. That's one of the very earliest signs that precedes the motor symptoms that we'll talk about in a little bit. Yeah, so it's super, super complex. And people see people with Parkinson's and they see the shuffling gait. They see the forward flexed posture. They see the tremor. but there is so much more to the disease that's underlying. We call them invisible symptoms, that actually, if people can be diagnosed earlier, their disease trajectory will be so much better because we can treat them sooner. Sure. So pandemics are usually equated, so people are actually calling this Parkinson's rise a pandemic. And pandemics are usually met with a very swift response. If you think about the AIDS epidemic, how much funding went into that and how much advocacy immediately and how effective it was, we're not seeing, unfortunately, that quick of a response to Parkinson's disease, but it's getting there. And programs like this one, the Parkinson's program, is what's going to be super essential. So we are seeing more funding going into programs like this to help people control their symptoms a lot better. So we can help now. Rehab and fitness professionals are expertly poised to help this population. And I just can't emphasize that enough, that exercise is medicine for these folks, and the sooner that we can get them in the door exercising, the better. Okay, so quick little look at the pathophysiology. So what is actually going on in the brain? So this is like a slice of the midbrain in a deep part of our brain called the basal ganglia. So in the basal ganglia, we have multiple different centers, and the one where dopamine is produced is called the substantia nigra. So you can see the substantia nigra of a person who does not have Parkinson's. It's nice and dark, and it's called substantia nigra because of the pigment that's produced. It's dark. And then over time with Parkinson's, this is a post-mortem autopsy. We can't see this until someone passes away, but you can see the depletion of the dopamine neurons. And one of the things that you can't really see very well in this picture is that it's asymmetrical. So you may be able to kind of see in the picture how this one has less color than this one. This one's a little bit thicker. People with Parkinson's generally present at first with asymmetrical symptoms. So they may notice a tremor on one side of their body. They may notice that one of their legs is dragging when they're walking. Those are kind of some other early symptoms that people may be experiencing. And then over time, as the disease progresses, it does affect the other side of the brain. For most people, not for everybody, but for most people. So the tremor that started in their right hand might be showing up in their left hand as well. People will always have a dominant side. So one side of their body will always be a bit weaker, a bit stiffer, a bit less coordinated than the other side. So the other thing I will mention, so this is just a little quote from actually Dr. James Parkinson, who wrote the essay on the shaking palsy, which was kind of like the first documented work about Parkinson's disease, and that was written in 1817. So what he's saying is so slight and nearly imperceptible are the first inroads of this malady, meaning Parkinson's disease. And it progresses so slowly that it rarely happens that the patient can form any recollection of the precise period of its commencement. So people don't really know, like, you can't say, when did you get Parkinson's disease? They don't have any idea. And for most people, when they are diagnosed, they already are missing at least 50% of their dopamine-producing neurons in their brain. They're already gone. And I would argue that most people, actually it's more like 80%. So it's a lot. So, which is why it's really kind of disturbing to see that a lot of folks don't start a program like Pedaling for Parkinson's and don't get an immediate referral to a Parkinson's physical therapist when they're diagnosed. Because even though they may not outwardly be showing all of the severe symptoms that can come up, they need exercise now because it's already taken a significant toll on their brain.
Are there tests that can show that you have it even before you?
No.
No.
Unfortunately, no.
Okay.
And Parkinson's is diagnosed based on inclusion and exclusion criteria by a neurologist. There's no blood test.
Okay.
There's no MRI or anything like that can say, oh, yep, you have Parkinson's for
Right.
sure. But they're working on it. That's one of the
Right.
places that a lot of funding is going, is identifying people who have a lot of those prodromal symptoms, like the constipation, the loss of olfactory ability to smell things. They even have studies being done with dogs who can actually sniff out Parkinson's. It's still very much emerging.